What's up, guys? So, in bed. It's 9:50 p.m. Thursday night. Tomorrow I have minor surgeries in the afternoon, mixed into clinic. 4 pterygium surgeries. I've never done one before. Literally sitting here watching YouTube, figuring out how to do it. I'll be doing it with an attending physician, so she'll be coaching me through it. But it's a surgery I've never even seen before. So, watch YouTube videos and then do it tomorrow. Just finished grand rounds. That went pretty well. The neuro-ophthalmologist, wants to maybe present the case I presented at meetings and stuff, so he liked it. So that went fine. Now we do clinic this morning, and then we get to do the minor surgeries this afternoon. So this is what a pterygium looks like. It looks like a triangle of fibrovascular tissue that's just growing across the front part of the eye, right over the center of the pupil, and that's basically what it does. It tends to start out over the white part of the eye. The conjunctiva, which is that thin, clear skin over the sclera, can start to kind of creep onto the cornea and can grow across the eye until it eventually obstructs the pupil, which is what it started to do in this example here. Now, sometimes it can start out as this, which is a pinguecula, or kind of a small yellowish elevation of the conjunctiva, and we call that a pinguecula until it starts to get onto the cornea, and at that time it becomes a pterygium when it starts to move on to the cornea itself. This can actually be brought on by sun exposure, and we think that's probably what causes it, but it's not entirely clear why these happen, but thought to be related to the sun. So what we'll do when it starts to creep onto the cornea like this, the reasons we might take it off is if it's beginning to cross over into the visual axis, if it's causing irritation, cosmetic reasons, or if it's causing damage to the cornea, thinning, causing drying of the cornea. And so basically what we'll do is we'll go in with minor surgery and we'll lift this off and then polish over the cornea where we take it off. So when we actually remove it surgically, we'll lift it off and it can leave a defect on the cornea itself. And then we polish that with a diamond-studded burr, which is a spinning ball that polishes the cornea to a nice smooth finish. And then we'll use a conjunctival autograft, which is the conjunctiva from somewhere else, and place it over the defect where we remove the pterygium to prevent regrowth of the pterygium. So it's 1:48. We're getting ready to start the first pterygium case here in a minute. It's one of two. Only 2 of the 4 patients showed up. So we'll do that. We'll do the conj autograft on the pterygium repair, and it'll be the first one I've done. So to recap on the surgeries and basically tell you how they went, we did 2 surgeries and they both went well, no complications, but it was a little different than I'd expected, honestly. You really actually have to be a little more forceful and a little less delicate than you would think you would need to be with an eyeball when you're operating on it. You really have to pull on the pterygium and really tug on it a lot of times to get it to come up off the cornea and to release. Or at least in these 2 cases I did, to get it to come off. It required more force than you would think. All of the operation is done under a microscope. It's all microsurgery because we're operating on the eye and the instruments are very small. For example, here's an instrument that is similar to what we would use. These are just practice tools that I have at home to practice suturing and stuff, but it's all very tiny instrumentation and all done under a microscope. So it's a very delicate surgery, but at the same time, you have to use a little bit of force sometimes to actually get the pterygium off the eye. There's more blood loss too than you would think. There's, not an insignificant amount of bleeding, probably, 2 or 3 cc's, which is not a lot in the, grand scheme of surgery. But for eye surgery, it can bleed a little bit with the pterygium surgery, probably more like 1 or 2 cc's. But it can have a little blood with it, so it's not a super clean surgery all the time. At least it wasn't in my experience. So it was a great experience. I'm glad I got to do it, and I'm glad that I got to do a lot of it. The attending that I was working with let me do most of the surgery, just kind of walked me through it. We did the conjunctival autograft, which isn't something that everybody does. Sometimes the pterygium is just removed and left, like a bare sclera technique, but I think you get lower recurrence rates of the pterygium. They don't grow back as frequently if you do the conjunctival autograft. So that's what we did, and it's a good technique to know. So I'm glad I got to learn that and do it. So both pterygium surgeries went well. We have more pterygium surgeries. Do it every Friday on this rotation, this 6-week rotation. Every Friday is pterygium surgeries and minor surgeries. So things like chalazion removals, eyelid cysts, lid lesions, that kind of thing. We all do that in the office under local anesthesia, either topical or with like subconjunctival or lidocaine injection just at the side of wherever we're operating. So that's mostly how we do it. We just go into the back room in a minor's procedure room. So I hope you guys liked the video. I hope you enjoyed getting to go along with me while I got to do my first pterygium surgeries. Hang tight for the next video. I'm going to take you guys on a call night, a Friday night call night with a 15-hour call, which can be pretty crazy sometimes pretty good. We'll see how it goes though. I'm Zach with Dr. Eyeball MD. I'll see you guys next time.